Welcome to this clinical walkthrough on the suspected meningitis case for UKMLA brought to you by Mediate, your 24/7 practice partner. So, let's dive right in. We're going to cover opening the consultation, taking a focused history, key signs and examination, sharing the diagnosis, and finally creating the management plan. This is the exact structure you'll need for your clinical consultation, a perfect framework for your OSCE station. All right, first things first. Your initial goal is to build a connection and figure out the patient's main concern. The best way to do that? A simple, clear, open-ended question. That's it. How can I help you today? This simple opener lets the patient tell you what's wrong in their own words. It perfectly sets the stage for taking a focused history. Okay, now for the detective work, you need to systematically explore this headache. And for that, the SOCRATES mnemonic is going to be your absolute best friend. Sticking to these steps, site, onset, character, and the rest, ensures you don't miss any of those critical details about the pain. Let's see how it sounds in a real conversation. And just like that, you've nailed down the site and the onset. Next up, you need to dig into the nature of the pain itself. What does it actually feel like? Good, you've clarified the character and the radiation. Now, the next question is where you start hunting for those key diagnostic clues, the aggravating factors. And there it is. That's our first major red flag. When a patient says light makes their headache worse, that's photophobia. Your alarm bells for meningitis should be ringing loud and clear. Okay, so you've got photophobia. Now what? Your questioning has to get a lot more specific. You're no longer just exploring a headache. You are actively screening for other signs of meningeal irritation. You need to ask these questions directly. Do you have any neck stiffness? Have you noticed any rash on your body? Have you had any fits? What about any vomiting first thing in the morning? Any weakness anywhere? Every single yes you get here cranks up the urgency. Now, even with your suspicions sky high, you can't just stop. You still need to complete the full history, past medical history, medications, social history, and please don't forget to ask about their ideas, concerns, and expectations. Finding out what they're worried about is absolutely key. Let's move on. History is done, and now it's time for the physical examination. This is where you're going to look for the concrete evidence to support what you're thinking. These 4 steps are mandatory. You'll check the vitals, looking for a fever. You'll do a full physical exam, keeping a sharp eye out for any rash. You'll conduct a full neuro exam, including their GCS. And finally, you'll test for those classic signs of meningeal irritation, Brzezinski's signs and Koenig signs. So, you've done your history and examination. Now comes the hard part. How do you deliver a serious diagnosis like this? Your wording has to be simple, direct, and most importantly, empathetic. Here's a great tip. Before you even say the word meningitis, start with a simple explanation. This gives the patient an immediate understanding of what you're talking about, which can help lower their anxiety. See how that works? Starting with "from the chat we had" links everything back to their own story. It shows you've listened and makes the diagnosis feel less like a label and more like an explanation. And remember, this kind of communication takes practice. You can practice this exact case right now and get objective feedback on mymediate.com. We're on the home stretch. A clear, confident management plan is absolutely essential, both for your patient's safety and for smashing this OSCE station. These are your 5 pillars of management. They're immediate, they're non-negotiable, and you need to state them clearly to both the patient and the examiner. Admit, isolate, inform, investigate, and treat. Now for the investigations. You'll explain that you need to do blood test and a lumbar puncture to check the spinal fluid for bacteria or viruses, and maybe a CT scan to look for any swelling. Explaining the why is so important for the patient. And treatment starts immediately. You can't wait for a confirmed diagnosis. You have to explain that because bacterial meningitis is a medical emergency, you need to start intravenous antibiotics right away. And this is a really important distinction you need to be able to explain. While all suspected cases get admitted, the path forward changes based on the cause. If it's bacterial, they're staying. But if tests confirm it's a mild viral case, they can often go home to recover with rest and painkillers. One last thing, and don't forget this, before you finish, what is your final responsibility? It's public health. You have to think about preventing the spread of the infection to anyone the patient has been in close contact with. And there you have it. That's the complete structure to help you confidently walk into that station and manage a suspected meningitis case.
To put all this into action, you can practice this exact case now on mymedi8.com.